The Patient Protection and Affordable Care Act, also known as ACA or Obamacare, is a comprehensive health care reform law with three primary goals. The first goal is to make affordable health insurance available to more people. The law provides consumers with subsidies that lower costs for household incomes between 100% and 400% of the federal poverty level. The second goal is to expand the Medicaid program to cover all adults with income below 138% of the federal poverty level. And the third goal is to support innovative medical care delivery methods designed to lower the cost of healthcare in general. This was a major overhaul of the U.S. healthcare system and aimed to reduce the amount of uncompensated care the average U.S. family pays for by requiring everyone to have health insurance or to pay a tax penalty. Here is a little background on how the ACA came to be. Universal healthcare efforts in the United States emerged in the late 1800s. While the government took no actions to subsidize voluntary funds, or make sick insurance compulsory, essentially the federal government left matters to the states, and the states in turn left them to the private and voluntary programs. The U.S. did have some voluntary funds that provided for their members in the case of sickness or death, but there were no legislative or public programs during the late 19th or early 20th century. During the Progressive Era, reformers were working to improve social conditions for the working class. In 1906, the American Association of Labor Legislation, also known as AALL, finally led the campaign for health insurance. In a nutshell, the bill limited coverage to the working class and all others that earn less than $1,200 a year, including dependents. The American Medical Association supported the AALL, while the American Federation of Labor and the private insurance industry opposed it. Here are a few key events that led up to the passage of the ACA law. In July 2009, Speaker of the House Nancy Pelosi and other Democrats from the House of Representatives revealed their plan, H.R. 3962, the Affordable Health Care for America Act, which planned to overhaul the healthcare system. However, in August 2009, Massachusetts Senator Ted Kennedy died and caused the Senate Democrats' 60-seat supermajority to be at risk. On September 24, 2009, Democrat Paul Kirk is appointed interim senator of Massachusetts and temporarily resets the Democrats to a 60-seat supermajority. The vote for the Affordable Health Care for America Act took place in the House of Representatives on November 7, 2009, in which 219 Democrats and 1 Republican vote in favor of the law. The vote in the Senate occurred on December 24, 2009, in which 60 Democrats voted for the Senate's version of the bill. However, in January 2010, Republican Scott Brown won the special election in Massachusetts to finish out the remaining term of United States Senator Ted Kennedy. Brown campaigned heavily against this healthcare law. On March 21, 2010, the Senate's version of the healthcare plan was approved by the House of Representatives in a 219 to 212 vote. There was unanimous Republican opposition. The ACA became a law when President Obama signed it into law on March 23, 2010. There are a few setbacks to the Patient Protection and Affordable Care Act. While the ACA has insured over 20 million people, however, 6 million individuals lost their insurance. The ACA has worked well for individuals who meet its criteria, but has not worked well for the middle and working class. Insurance companies canceled many of their plans since they did not cover the ACA's 10 essential health benefits. And although the ACA contributes to the spending decrease, the health outcomes remain poor in the United States. The United States spent more on healthcare than any other industrialized nation in 2017, but ranked 26 out of 43 in life expectancy. Furthermore, according to the American Public Health Association, only 3% of our healthcare spending is focused on prevention and public health. The primary focus is on treatment. Chronic conditions such as arthritis, heart attacks, and obesity are the most common healthcare problems in the United States and are also the most preventative. These chronic conditions accounted for 86% of healthcare costs. Current health disparities are also on a worsening track. Health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. For example, African Americans of all ages are more than twice as likely to die from diabetes. And Hispanic high school students are 80% more likely to attempt suicide than non-Hispanic white high school students. ACA is also causing taxes to rise. While it is seemingly impossible to create a law that will provide benefits and satisfaction for every single person in the United States, there is still work that is to be done.